Welcome to the masterclass on cardiac health on the occasion of the World Hypertension Day. So I would like to introduce the first speaker, Dr. Eileen Kande. She is the HOD at Sir Richard Reliance Foundation Hospital. She has a wide experience in 27 years. Dr. Kande has had a deep understanding of nutrition and dietetics, and she is not only well-versed in traditional nutrition practices, but also specializes in innovative field of nutrition informatics, making her an expert in digital dietetics. Her expertise extends specialized areas, including critical care ICU, oncology, renal nutrition, bariatric nutrition, weight loss strategies, nutrigenetics, as well as being a diabetes educator and gut microbiome. In addition to her clinical work, she is the proud founder of the Academy of Nutritional Sciences, an online platform dedicated to advancing nutrition education for dietetic professionals and budding dietetic students. At the Academy of Nutritional Sciences, nutrition, sports nutrition, even total parental nutrition, pediatric case studies, among others. Okay. We can have Dr. Eileen Kande with the first class on cardiac biomarkers.
Thank you, Vedika. Hello, Jennifer. Thank you for joining us today. So, Jennifer and myself, we are going to take you all through a very enlightening pathway of just enjoying this day on educating each and everybody a little bit about cardiac health. Of course, in this 1.5 hour session, it is not possible to complete everything about cardiac health, but definitely we'll try to put the most practical aspects that is required in cardiac health. And as Vedika rightly said, that today what I am going to talk about is on cardiac markers. And in my experience with dietitians and students, I have observed that, sometimes we know a lot in nutrition. We know a lot about hypertension. We know our numbers. We know cholesterol. We know HDL, triglycerides. But when it comes to cardiac markers, especially the biomarkers which are related to people who get heart attack or people who are into heart failure, we are unable to identify that with the blood reports. So today, exactly what I am going to talk about is what is the cardiac markers that is important for you as a dietitian to see. So I'm going to share my slide. If you can give me a minute. So today, along with understanding various cardiac markers, we have Jennifer who's going to talk about the foods that are, basically cardiac friendly, heart friendly. Whilst I'm going to give you a little gist of the benefits of garlic. And I'm sure that all of you all are prescribing garlic as one antioxidant for various reasons for cardiac patients. So let us look a little in detail of how it will help you. So how common is diseases of heart in India? And that we know that the statistics tell us that it is a leading cause of death. Definitely, at least 1 in 4 are, uh, sorry, change the slide. Yeah. Okay. We know also the functions of the heart, which beats throughout the day. It pushes millions and gallons of blood to each and every part of the body, carries oxygen, fuel, hormones, essential compounds, waste products, everything. We also know the various kinds of heart diseases. So whether it is coronary artery diseases, atherosclerosis, or heart failure, we are aware of that. Now, coming to the cardiac markers, although cardiac calcium scoring is not a marker of cardiac arrest, but we have heard about calcium scoring. And therefore, I thought I would put calcium scoring slide here so that people understand, because previously calcium scoring wasn't done so much. But today, when a doctor advises a heart scan, he also sometimes called for a calcium score, and it is also called the Agatstone score. And it is calculated based on the plaque that is observed in the CT scan. So basically, a CT is done on the patient's heart, and whatever plaques are seen based on the calcium deposits and the cholesterol deposits, there's a calcium or the Agatstone score that is calculated. Now, this can be converted into a percentile that can be also based on your age and gender. Now, the purpose of this test is to understand the risk of heart diseases and to take a preventive or corrective measure based on the result. So when we say that the score is 0, it means that there are no plaques and this person is safe. He has a very, very low risk of a heart disease. There are people who have a score from 1 to 10. Now, of course, the score also is based on age and gender. Nevertheless, anybody having the score from 1 to 10, it shows that there is small amounts of plaque present and less, but the person can have almost a 10% chances of having a heart attack. And but still the risk is pretty low. When the score is between 11 to 100, it means that there is a mild disease and there is moderate chances of a heart attack. We often hear that people suddenly die of a heart attack. Maybe they have never done a calcium score, or maybe they haven't done any cardiac test early. Now, besides the usual tests that we have, where we look at cholesterol, LDL, HDL, VLDL, all those things, we nowadays we also look at the calcium score. When we find it between 100 to 400, we know that there is a moderate amount of plaque present. These are the people who you need to give an extra restriction of fat and cholesterol rich foods. These plaques, they do block the artery, and the percentage or the risk of this person having a heart attack is more likely. Definitely, people who are having a calcium score of over 400, they are at a very, very high risk of having a heart attack. Now, when you look at the calcium score and you are giving a diet for that patient, you can understand that, okay, you give an I give you an example of, okay, one patient will tell you, I eat eggs every day, or I eat, non-veg foods every day. That's based on your calcium scoring and based on the understanding of how much is the calcium scoring and the plaque formation. You can also advise how much of cholesterol you need to give to the patient. Whether you want to advise and tell the patient, okay, your calcium score is 0, or it is 10, you are in a safe zone, you please can go ahead and have your egg yolk every day. But if you find somebody who's having a calcium score of, say, 100, and you want to restrict the total cholesterol or the triglycerides or the fat that the person is consuming, that's when you can bring your advices for having healthy fats into play here. So what I'm trying to tell you is how you can relate the calcium score to the advice that you give for your patient. So it is not very abrupt, like, how much of fat will you give, or how much of cholesterol will you give. Here exactly, why are you giving those fat and cholesterol. We know that the risk factors are diabetes, high cholesterol, smoking, and various other factors. I won't specify much on these reasons, because I want to talk very importantly about the markers, which will take some time for me to explain to you. Now, there is something called a universal definition for heart failure. So, heart failure, it provides a staging approach for classification of heart failure. It ignores the ejection fraction and focuses on prevention, early stage of disease and symptomatic stages. Previously, it was the 2D echo that was done, and that was, or the ejection fraction that was important to understand what is the heart failure. But as on today, just as we have something called as a pre-diabetic, we have something called as a pre-heart failure. So if you, some of you who have not heard of this term, pre-heart failure, please understand that this is basically, if you look at the blue mark here, it shows that it is a stage B of the pre-heart failure. That means this patient without current or any, the patient may not have any symptoms, or it may not have any signs and symptoms, but may have other problems, may have a structural heart disease. Okay, or there is a risk factor of they may be having a positive natriuretic peptide levels. This person is known as a pre-heart failure. Now, in a symptomatic heart failure patient, which we call as stage C or stage D, they are with symptoms. So people who already have signs and symptoms of heart failure are in stage C and D. And people who are at risk and who can be preventable, this is where, you know, your role dietitian comes importantly into play, because when you are at risk of heart failure, it means that here is where you probably have to talk to the person about hypertension. You talk about CVD, you talk about obesity, you talk about genetics, you talk about family history. These are the preventable risk factors which can be spoken to the patient at that stage. So there are basically 4 stages. Stage A, which is a preventable at risk stage; diagnostic, which is pre-heart failure; and symptomatic heart failure, which is a stage C; and stage D is a prominent heart failure case. Now, the impact of high blood pressure on the heart, we know that it does have, the blood pushes against the artery, and there is a difficulty in pumping of the blood. However, these are some of the signs and symptoms of high blood pressure. Most of y'all, since we are celebrating uh, Hypertension Day, I thought it is important to talk a little bit about hypertension. But my main focus today is on what are the cardiac markers. Now, what is the meaning of cardiac biomarkers? Cardiac biomarkers is something that is done to a patient who experiences some kind of a heart issue. Now, cardiac biomarkers, why are they important? Because they should be timely. It should be done on time. Remember the golden hour for the patient to be detected. It should be accurate in diagnostic and the management of acute coronary syndrome, as well as prognostic. So diagnostic of this golden period is of utmost important to institute therapy as early as possible to reverse the myocardial damage. So cardiac biomarkers is also a powerful tool for triaging. Now, in case, see, sometimes we find patients who have symptoms like, we may think it's a heartburn, but we may not realize that it may also be a myocardial infarction. So in case, even if there is a doubt of a heartburn, there's a doubt with a chest pain, it is better to get it checked than not get it checked. Okay, so when you get, even if you get a little say cringe in your chest, or you get some pull in your chest, or you feel the burning sensation, that's an exact sign for a myocardial damage. And this is very important to understand it as earliest as possible. So what is the nature of the test? Now, what are the kind of tests that are done for a person who will come typically to an ER, or they may come to their local doctor, or they may come, or sometimes it happens even in front of you as a, you know, last week when my colleague and myself, we were counseling a patient, and the patient went into hypoglycemia. We called for, there was a code blue that was activated, and when we called the code blue team, the patient was into hypoglycemia. We managed the patient, took the patient to ER, and the patient survived. So a timely test and a timely action is very, very important. Hence, even in her heart attack, the time is the most important factor, and that golden hour should not be missed. So what is the test that is done when this patient goes to the doctor? So typically these markers will include three main categories. One is the enzymes, then is the hormones and the proteins. So cardiac biomarkers, they show up in the blood after the person has undergone a severe cardiac stress or a heart stress because of the injury, or because the heart is not getting enough of oxygen. That's when the person can get a can have the cardiac markers activate. Now, how do you classify cardiac markers? You have heard, no? When you read the test, you see, oh, there is a troponin, there is a C-reactive protein. Some patients have a myoglobin test, some patients have an IMA test. So sometimes, as nutritionists or dietitians, we may get confused because we may wonder why so many tests, isn't it as easy as doing a diabetes test, like doing a fasting blood sugar, postprandial blood sugar, and HbA1c. But here there are so many markers, so we all are aware of those diabetic tests that are being done. But sometimes we fail to understand what is the cardiac biomarkers and why are so many tests being done for one heart attack. Okay, so let me divide the biomarkers into three categories. The first category is the biomarker of myocardial infarction. That is the injury. So it means there's an injury to the myocardial. It means it's an injury to the heart. Okay. It also means necrosis or the death. So it could be that there is a damage to the tissue of the heart. Okay, in which you do different tests such as CKMB fraction, myoglobin, cardiac troponins, modified albumin, then HFABP. There is another biomarker which is a hemodynamic stress test. Now, remember, we are talking about myocardial injury. We are talking about hemodynamic stress. Now, hemodynamic stress is when there is a change in your blood parameters. That is the natriuretic peptides, NPS, atrial natriuretic peptides, ANPS, N-terminal pro-BNP. You may have heard of NT-pro-BNP. You may have also heard about B-type natriuretic peptide, that is BNP. So mostly when the patients come to you after a cardiac arrest, or if there are some rehabilitation dietitians here, they would be, when they look at the previous reports, you may have already had a person who has had a cardiac arrest, and they come to you with a big set of reports, and they keep those reports in front of you, and you go through those reports, and you are looking at all these tests, NP, BNP, all those things, and sometimes you need to interpret those tests, right? So these are basically hemodynamic stress markers that was done to that patient at the time of the cardiac arrest. Okay, now there's another inflammatory test that is done. We are all aware of the C-reactive protein or the CD40L homocysteine. Now these tests are usually prognostic markers for future. Okay, so it will also give you a futuristic approach. So basically the biomarkers are divided into three categories. You have to remember these three categories. I will explain each and every term in my future slides. Now, one is the cardiac troponin, one is the creatinine kinase, that is CK, one is the creatinine kinase myoglobin binding, that is CKMB. That also I will explain in my future slide. And the myoglobin. Okay. What is the difference between all these three tests? I'm just going to explain that to you. In the meanwhile, there is one more, that is the ischemia modified albumin, peptides, as well as C-reactive homocysteine or the soluble CD40. Now, what is CKCPK? That is creatinine phosphokinase. So this is found very high in your skeletal muscle, in your myocardium, and in your brain. Now you can imagine that your CK is found not only in your heart, it is found everywhere else, right? So that means if there is an injury either to your skeletal muscle or to your myocardium or to your brain, this phosphokinase will be released. Okay, why? why it will be released? Because there's a contraction to the muscle. So when there's a contraction to the muscle, there is a release of this phosphokinase. Now, how do you know that this phosphokinases come from the heart and not from your brain or your lung or your skeletal muscle? Because it is present in those areas also. So to understand that whether this CPK is from the heart, there is something called an isoenzyme. So there are three isoenzymes. One is CKBB. BB stands for brain and lung. Okay, that is CK1. Then there's another one called CKMB, that is CK2, that is predominantly found in the cardiac muscles. Now you can you relate this, that when it is CK2 MB, it is to your cardiac muscles. If you look at the slide, it will very clearly show you this. And there is another CK3, which is MM, and MM is found only in skeletal muscles. So when you get your blood test of a patient who's undergone cardiac arrest, you will get CKMB, CK2, and this is only found in your cardiac muscle. So when this enzyme, isoenzyme, is high, it means that this person has got a cardiac arrest. So CK2MB is present only in the cardiac tissue. Hence, it is very specific to cardiac arrest. And early diagnosis is very important. And this CKMB is actively seen when a person undergoes heart attack. What is the time sequence of its being released? So it usually after the heart attack, because it is from the myocardium, it gets released within 16 hours. And it increases within 16 hours. It peaks between 12 to 24 hours, but it also goes down in 4 to 5 days. So if somebody has got a cardiac arrest after 4-5 days back, you will not be able to see CK2MB, right? But if the person has got a cardiac arrest within 12 to 24 hours, the CK2MB will be high of this person, right? So this is how you will know that when the person has got the heart attack. There is another very, very specific test. You all may have read about troponin, right? Now, troponin is not an enzyme. Like the previous one, this, if you look at it, was an isoenzyme. The CPK is a phosphokinase. It's an enzyme. But this is a troponin, is a protein. Okay. Remember that this protein is also present in heart and skeletal muscle. It is released when there is acute myocardial infarction from the heart, sometimes also because of pulmonary embolism. This troponin is also got three components. Okay. One is troponin C, one is that is calcium binding, one is troponin I, which is inhibitory elements, and one is troponin T, which is the tropomyosin binding element. So for a cardiac troponin, the troponin I and the troponin T are important, not the troponin C. So just let's take a look at why T and I are important. So as I told you, CPK-MB increases from 12 to 24 hours. This increases in 3 to 4 hours. Imagine that if days of it in 3 to 4 hours with the peak level of 3 to 10 hours. And it remains up to 10 days. That is, the troponin T remains for 10 days and troponin I remains for 5 days in your bloodstream. So even if the person has got a heart attack 10 days back, the troponin T will tell us that. Because sometimes it does happen that a person has gone out for a holiday or the person is traveling and the person has felt that there is something, there was a pull or it felt that angina pain and taken it off as a heartburn, say nahi kuch nahi hua, abhi main theek hu. Okay, but to act, and when the person comes home, these are all real stories, they have happened. When they come back home, they explain, they go to their local doctor and the local doctor says, okay, let's do a test for you to see. And when they do this test, and even if it is 10 days from when they have got a cardiac arrest, they will find the troponin T elevated. So when they find the troponin T elevated, they can take action at that time so that the person does not have the other heart attack. There is a level, these are the normal ranges. It's zero actually, almost zero in the blood. But when there is a heart attack, it is very, very high. Okay. Now these tests are very, very sensitive. They are very specific. And the best part of this is that it is early detectable. And it is not only early detectable, it stays in the blood for a longer period of time. So even if you have missed the bus, you can always check it later on and see whether the person has got heart attack. So therefore, this troponin T and troponin I are important markers. There's another marker which used to previously be done a lot, which is the lactate dehydrogenase. But today this marker is not of very great use because you can look at the location. Where do you find lactate dehydrogenase? You'll find it in your heart, you'll find it in your RBC, you'll find it in your brain, kidney, skeletal muscles, ileum. So, and when there is an injury to any of these, it could increase. Okay, sometimes you may do over exercising also, and your lactose 6 to 12 hours, 30 to 48 hours, it returns back to normal in about 2 to 6 days. But it may not be a very good marker for a cardiac arrest. You remember when we were in college, in our days, we have learned SGOT. Heart means SGOT. So we learned this as a main marker, and we took that along with us to our hospitals where we worked. But today, as I talk to you all, there are so many more markers that have come in. There are more newer markers that have come in, which we need to upgrade. We need to know what are the markers. So SGOT, which is also called as the AST, is there. But it is kind of an older marker, which is again not very specific to the heart because it is present everywhere else. It's from the liver as well. Now, this is a very interesting myoglobin. It's my favorite because as soon as you get a heart attack, the myoglobin is a first protein. It's a protein. It's not an enzyme. It's the first protein that gets released from your heart. Why? Because it has got such a light molecular weight that it gets released very fast within the first 1 hour. So if you look at all the other tests, it still takes 3 hours, 4 hours, 5 hours to increase. But if you test myoglobin, it will be the first in the first 1 hour. Okay. The good thing is that it peaks between 8 to 10 hours. But the bad thing is that it returns back to normal in 1 day. So if you do a myoglobin for a person who has had previous history of heart attack, you may not get a positive test, right? So therefore, myoglobin is actually a transporter of oxygen to the muscle, and its level increases rapidly rather than, you can't take myoglobin as a full sensitive marker. So it is sensitive to cardiac, okay? It is an early marker, okay? But it can also increase when there is a skeletal muscle damage. So when your myoglobin is high, it may mean that you may have a heart attack or you may have a skeletal muscle increase. Now, when you have a skeletal muscle increase or a heart attack, you may not understand what exactly has happened. So hence, after doing a myoglobin test also to confirm whether this is a heart attack, you also need to do a troponin T and a troponin I test. Okay, these are the normal levels. Now this is the favorite, NT-proBNP. All those who are working in cardiac units or cardiac setup must have read about this. It is, the full form is N-terminal pro-B type natriuretic peptide, and it is mainly synthesized by the cardiac muscle in the left ventricle, and it responds to the myocytes of the ventricle. Now, this is just a graph which shows you what is the level and the time onset of the symptoms. So if you look at the first one, the MB is within the first 1 hour, okay, but it dies off within 1 day. Similarly, CKMB again increases in the first 1 to 3 hours, but dies out after 2 days or so. Troponin T and remains even up to 7 to 10 days. Okay, so just for to summarize the test the test that we do, I thought I will show you and understand. So the first test is the most sensitive is the troponin test. Okay. It is the second is the creatinine kinase test. Troponin test is the first 12 hours, creatinine kinase 10 to 24 hours. Then stuck here. Glycogen phosphorylase isoenzyme BB. Also, yeah. Now, okay, I will come to a question just to test your this thing. When cardiac troponin test is not available, which of the following test is a better chat boxes? Though I cannot see the chat boxes. Is it CK, MB, creatinine kinase, or lactate dehydrogenase, or troponin 1, or urine? So let me give you a hint. Myoglobin is never tested in urine. Okay. So the CK, MB fraction is the answer. Sorry, the troponin 1 is the answer. So it's the most specific test used for detection of myocardial injury. So amongst these biomarkers, now there is others which are newer ones which are coming, which is the microRNA, but it is still in the evolving phase. Okay, so are we ready for the next one? If you all have any questions, what we can do is we can take it garlic, which I had promised that I'll do in this lecture. So I would like to understand from my audience here that has anybody used aged black garlic? Or I'm sure all of you all have used white garlic, crushed garlic. How many of you all use garlic specifically for cardiac health, for patients who come with high cholesterol levels or patient who comes for other ailments? We all know the benefits of garlic. Yeah, I hope you're answering the chat because I can't really see the chat box. Okay. So today I'm going to talk about the aged black garlic and how it is good for you. Uh, Now this is a little new. It's a little new for me as well because recently when I've been going to some gourmet hotels or restaurants and they have started using black garlic. So I was a little curious to understand what this black garlic is all about. And I started doing some study and research about it. And I found that the Asian countries, uh, Korea, Japan, and Southeast Asia, they have been using black garlic since centuries. And basically, first I thought when they serve it at restaurants, especially the Asian restaurants, I thought it was burnt garlic. And then I realized, no, there's a difference. It's not the same. Burnt garlic and black aged garlic is not the same. They are two different things. So let's do some more study about it. You have to learn and you have to evolve because now the world is becoming one. So you have to know everything that's happening everywhere in the world. And when I did my research, I found that actually this was originated in Korea. The Japanese and the other countries also use it, and now it's in India as well, and originated in Korea. This is basically a garlic that has been fermented. Yeah, so in India, we use for a lot of fermented foods for a very, very long time. But somehow I haven't heard of anybody of we using garlic. Unless somebody has heard, they can educate me on it. But this black garlic was very interesting for me, and therefore I did a little study on it. So I also wanted to understand what is it in black garlic. So it contains S-allyl cysteine. Okay. Everybody knows what is in white garlic. Can you all type in the chat box? What is the ingredient? And I'm sure everybody knows it, but it's just for fun. what is the ingredient, a bioactive ingredient that is present in white garlic that we all use for our patients, cardiac friendly. Yeah, they have typed, right, Allison? Allison? Yes. Okay. So good. I've been told that you all are typing Allison. Right. Now, in this black garlic, there is S-allyl-cysteine, which we call as SAC. Okay. So S-allyl-cysteine is the main ingredient. Now, what is the difference between S-allyl-cysteine and allicin? Besides S-allyl-cysteine, this also has polyphenols and flavonoids. Okay. And some sulfur compounds. We know that garlic has got a lot of sulfur compounds. So what is the difference between regular garlic and black garlic? Both are good. It's not that I'm saying white garlic is not so good as the black garlic, or black garlic is better than white garlic. Both have got good antioxidants, immune system. They help the cardiovascular system, digestion, inflammation. Bad breath, yes. Sometimes we don't like to eat garlic, especially in offices or when we are traveling, we don't like to eat foods with garlic because of the bad breath. And it does have a lot of sulfur containing compound. But what I found out when I did my study on the black garlic was that the S-allyl-cysteine was more stable than black garlic, and in black garlic rather than in this thing. So I will just read out for you. So basically, allicin is an organosulfur compound that is produced when garlic is crushed or chopped, and it is responsible for the distinctive smell of garlic, especially various biological activities, including antimicrobial, antioxidant. So, but one thing is that allicin is relatively unstable. You remember we say that you have to crush, you cannot eat the garlic full. There are patients who come to us and say, "Akka khayenge to chalega." So we said, no, it's better you crush because we want the allicin, we want that sulfur compounds. So, and these, but allicin is relatively unstable and they can be converted into other sulfur containing compound. Whereas the S-allyl-cysteine, it is more stable compound and it is often derived from this aged garlic, and it has its own set of health benefits, including antioxidant, anti-inflammatory, neuroprotective. And so both have got health benefits, right? But that was one very interesting point that I saw over white garlic. Now, what makes the aged garlic different? Because it is the aging process and the transformation of chemical compounds of garlic leading to several notable changes. So, the flavor, the aroma, the texture, the nutritional value. And flavor is something like, I think it's in the next slide. I already explained about this. So, it is there somewhere. Okay, so I'll just go through what is a aged garlic, how is it prepared. Now, as I said, it is a fermentation process, and this fermentation is done in a controlled temperature and humidity environment. It is done anywhere from 60 days to 90 days. It's not like it just fermented for 2 or 3 days and it's done with. It takes 6 months to 9 months, 2 months to 6 months or so, 60 to 90 days to actually create this black garlic. Through a reaction we learned in our food technology class, the Maillard reaction, which leads to a characteristic dark brown color, mellow flavor, and its process also enhances the bioavailability of these beneficial compounds. So it is more stable. It helps in heart. How does it help in heart? It is shown to reduce cholesterol, triglycerides, blood pressure, blood glucose. There were studies. It's not that I'm saying it. I've read a lot of studies also, because not too many studies, but there are quite a few studies which show that especially in 12 weeks, they have checked whether there is change in triglyceride, cholesterol, LDL, HDL, fasting blood glucose, diastolic, etc. And they have found that there is a reduction in the serum triglycerides in 30 days. There's also a reduction in the overall total cholesterol, LDL, HDL, and basically a change in the blood sugar, reduction of diastolic blood pressure and systolic pressure. So while black garlic is generally considered safe, beneficial for most people, there are certain groups who should not have it and who should not have it. It is remember that it may be allergic to people who have garlic allergy. Remember, some people are also on anticoagulants. So people who are on warfarin or any kind of acetone or anticoagulants should be careful when they are taking black garlic. Okay. Also, since there are no much tests done on pregnant and breastfeeding women, I cannot suggest or I cannot say anything about it because I have not read any studies about it. And some people, although usually the black garlic does not have a problem, but some people may have a digestive issue. In fact, there are some people who don't have a digestive issue with the black garlic, but they have a gastric issue with the white garlic. So you can find out from your client or your patient how they feel about it. So whilst I stop presenting, you know that I have been told that there is a black garlic supplement which Throat Ready wants to give to some of them, but I just told them
इथं
that
बस माझं पण लेक्चर सुरू आहे.
we have
बस
about
इथं.
166 people here, and probably everybody cannot get it. But I have an idea, so I have a question for you. And how many? 5 or 10? 5. Okay. So we have extracted black garlic supplements. Yeah, you can give one tablet per day at the most to start with, if you're the thing. And if you're giving the entire garlic, just as normal garlic, you can use it. It's not harmful. So the question I'm going to say right now, the first 5 who answer right in the fastest finger will be sent a sample of the black garlic supplement sample. So the question is, I can't read the chat notes. Wait, let me just check. I also need to check them. Okay. Okay. So the question is, what is the bioactive ingredient present in black garlic that makes it different from white garlic? If you'll have a fastest finger first with the right answer, the first 5 will be given. It's better you type the full form, no SAC. Okay, that's good. I'm so happy that everybody has understood my lecture and they have listening to me. Okay, thank you. Yes, I can see too many. I think the sponsors will have a tough time giving to so many of them. But nevertheless, thank you very much. I really enjoyed giving you all this talk. And if you all have any questions to ask me right away, you can. Otherwise, we'll just wait for Jennifer to complete her lecture so that we both can take the questions together. Thank you so much.
We will have Miss Jennifer for the second session on functional foods for cardiac health. I would like to introduce her. Jennifer is a registered clinical dietitian and nutritionist at Nutrition Wellness Coach, genetic nutrition counselor, and the founder at Jennifer's Health and Diet Solution. She has worked in more than 22 years in all areas of health and illness in a variety of different settings, ranging from hospitals to private clinics, gymnasiums, hospital kitchen, and community centers and polyclinic. She's a visiting consultant dietitian at Sapna Hospital, Paramount Hospital, Medicare Hospital, Ashirvad Hospital, Rachna Hospital, Dhanvanti Hospital, Puja Hospital, Ageless Medical Aesthetic Clinic, as well as in corporate areas. Welcome, Ms. Jennifer.
Hi.
Hello.
Okay, so I'll just share my screen first.
Are you able to share the screen?
Just one sec, just some error. Just one sec. Some issue हो रहा है. Some issues happening. Can you share it?
Okay. I'll ask somebody to share the slide.
Thanks. Thank you. So I'll just say next, and whoever is managing the PPT can change the slide. Okay. So hi everyone. My name is Jennifer Dhuri, and today I'm going to talk about functional foods. And most of us, we basically use functional foods in our daily diet actually. So when we drizzle some lemon juice onto our poha, or when we sprinkle some black salt onto our dahi, we are actually using functional foods. But foods, when we term them as functional, what we are trying to say is, while all foods are functional to an extent, the term implies the health benefits which are beyond just the calories and nutrients. Next. So if you go in for the definition, the Academy of Nutrition describes functional foods as a whole fortified, enriched, enhanced food that has potential health benefits when consumed regularly in an effective level as a part of a varied diet. Next. So what are we going to be looking at now is the heart and the foods that can support your heart. So when we talk about the heart is made up of cells. You can strengthen the heart and you can weaken the heart by what all goes into your body. Now the heart pumps blood, and so the viscosity of the blood is important to consider. The contents of the blood makes the difference, and also the blood vessels, which we must know as these are the number one cause of heart disease. So now I'm going to tell you something about cholesterol that the liver makes. Now, 80% of your cholesterol that the liver makes is from glucose. 20% of the cholesterol is actually made from fat. So, in itself, if I tell you, it's not the ghee on the roti that is the problem, but the roti below it that is the problem. So, we usually blame the wrong person just because they are associated with somebody who is not so good. So, bichara ghee, any which ways. What I am trying to say is that when we are talking about foods for the heart health, most of us, people believe that it's just not consuming fats, not consuming, your ghee, etc. But it's much more than that. So there are two main types of cholesterol. We all know this. The liver makes the HDL cholesterol, the LDL cholesterol. Now the HDL cholesterol is called the good cholesterol. Why is it called the good cholesterol? Because it carries the excess cholesterol back to the liver, and that's why it's called the good cholesterol. The other type of cholesterol is your LDL cholesterol, which is called the bad cholesterol. Now, actually, our body doesn't make anything bad. But why is it called the bad cholesterol? That's something we have to understand. So if you understand the role of LDL cholesterol, it's the repairer and it's the rebuilder. So whenever there is any kind of repair that has to be done or rebuilding that has to be done, it is where you will find the LDL. So LDL, so basically when the brain requires fat, so the LDL is the LDL is the one that delivers the fat, the cholesterol to the brain. So when we are talking about the blood vessels, it is very important to understand that because the HDL is high density, you will find it basically, swimming around in the middle of the blood vessel. When you talk about the LDL, you will usually find them, because they are low density, you will usually find them on the sides, on the border, just like you find the fiber in a loaf of bread. Now, in our lifestyle today, there are a lot of chemicals and a lot of toxins from the environment that come into our bloodstream. The blood starts breaking into the bloodstream, and they break down the endothelial lining of the arteries. So these are basically exposing, the blood vessel is exposed to these chemicals. In fact, today we are taking in so many chemicals, so many toxins into our body. So today, even this chair that I'm sitting on probably is giving me some kind of chemicals that is going to disrupt my system. So the endothelial cells that line the arteries usually get damaged. And this is scarring of the tissues that is taking place. The walls of the arteries are scarred. They get stiffer. They are getting more built up. They are getting plaques. So when you are basically on a high carbohydrate diet, the excess glucose, it binds to the proteins in the blood. It gets stuck to the walls of the arteries. They start narrowing. The blood vessels, they narrow. And the plaques, when they get dislodged, they enter into your arteries and they give you a heart attack or a stroke. So we have an amazing body that actually has the power to heal itself. So the first thing you need to do is to stop the influx of these toxins into our system. And the next would be to add some good functional foods, which can help to balance your hormones, which can help to reduce your lipids that are gone haywire. So let's see what all functional foods we can add into our diet to reduce the inflammation and help reduce the high cholesterol, etc. in our bodies. So when we talk about functional foods, how is it going to help your cardiovascular health? So in cases of cardiovascular diseases, when we talk about functional foods, it is going to help you reduce your LDL cholesterol. It is supposed to help you raise your good cholesterol, that is your HDL cholesterol. It has to lower your blood pressure. It has to stabilize your heart rhythm and protect your arterial lining. Now, when it comes to taking in functional foods, we have to see that people are aware about certain foods that are helpful, but they may not know how to incorporate them into your diets. They may struggle with a lot of myths that are going around, a lot of misconceptions. Some people may say this is good, some people may say this is bad. There is a lot of confusion regarding taking certain foods because they are not regionally available. We are very much still, we go by what the West is saying. So many a times when they try to look up about functional foods, you will always find a lot of Western influences. So you will not find certain foods that are actually regionally available. There is an expense involved many a time. Sometimes more, people feel that this is not going to really enhance the taste of my, diet. So this is a little struggle when it comes to consuming heart healthy
Jennifer
foods.
ma'am, sorry to interrupt you,
Yeah.
but the slides are not moving.
Okay.
Now it has moved. Now we can see the
Okay. All right.
slide.
Okay. So when I talk about functional foods, a functional food is not a magical wand that can make your heart ailments just go away and just vanish. You can add them to your daily diet to prevent cardiovascular diseases, but it has to be a part of a wholesome diet. So let's go on to the functional foods. You can change the slide. Next. So when we are talking about functional foods, the first and foremost that we know also is the fruits and the vegetables. Fruits and vegetables are abundant in phytochemicals, antioxidants. They are rich source of fiber. They are basically foods that are your onions, your tomatoes, berries, the apples, the cabbage. They contain a lot of anthocyanins. So your berries, your raspberries, blueberries, your cherries, your purple cabbage, they have shown to have a beneficial effect on your endothelial lining, and therefore they can help avoid atherosclerosis. It can help you reduce your blood pressure, and it can also reduce the inflammation. Next slide. So when we are talking about the vegetables and the fruits in our diet, let's talk about the olive fruit as a extra virgin olive oil that we can consume. Now, basically, this is actually not something that is local, but it has become very popular. It is now olive oil is available to everyone. And sometimes I feel that if a certain food is beneficial, you can definitely add it into your diet. So the olive oil is basically rich in the oleic acid, the monounsaturated fat. It helps to avoid the oxidation of the LDL cholesterol. It reduces the inflammation. It is a source of the antioxidant vitamin D, which again helps to reduce the oxidation of the LDL. Now, one thing you can understand is that we can use healthy oils in our diet, healthy fats in our diet. Now, when we talk about healthy foods, when we talk about heart healthy foods, the first thing that people usually do is totally go off fats in their diet. And this makes their food so unpalatable that they are actually not able to take in good nutrition. So when you consume healthy fats in your diet, you can actually increase the taste of the food, and you can get much more nutrition because your appetite is much better. Next. So the other food that I will talk about is your grapes, especially the red grapes. Basically, the red grapes contain the resveratrol, which is an antioxidant. It contains anthocyanins, which will help you lower your blood pressure, especially the systolic blood pressure. It has a good amount of potassium as well. Hence, it will avoid any kind of blood clots. It will help to reduce your blood pressure. Grapes also contain antioxidants, quercetin, vitamin C, beta carotene. It helps basically to dilate the arteries and the veins, and thus helps to reduce your blood pressure. It helps to reduce any plaque formation. It has a basically, even when you talk about grapes, you should not just consume it in the juice form, because there is the highest concentration of the antioxidants in the grapes is in your skin and the seeds of it. So consume it whole would be good. You can consume about 1 to 2 cups or about 150 to 300 grams of grapes, the red grapes, to give you beneficial effects. Also, we can see fermentation does not reduce the antioxidants in the red grapes. Next. We have to consume a lot of vegetables in our diet. Enjoy a colorful varied vegetables in your diet. You can include the cruciferous, the broccoli, the cauliflower. You can include the dark purple colored vegetables like your beets, your eggplants. They will help you to improve the antioxidant levels in your blood. Next. So when we talk about vegetables, we need to go green. Highest phytonutrients are present in the greens. They are anti-inflammatory. They are a good source of nitric oxide. Basically, the nitrates that are present in the greens, they are vasodilators. So they help to improve your blood pressure, and they help to improve your arterial function. They are also a good source of potassium, folate. Folate is good. It is good to reduce your homocysteine levels. It has vitamin K1, it has vitamin C. So definitely include greens into your diet. Greens should be included pretty regularly in your diet. You don't need to have greens in each and every meal. It is always important to understand that you need to have a variety. So adding greens at least 3 to 4 times in a week is definitely going to help you. Next. This is something that I wanted to mention, although Eileen ma'am has mentioned about the fermented garlic. So I just put this slide to show you how fermentation of a food can also be beneficial. So here I'm talking about the sauerkraut, which is the fermented cabbage. Cabbage is a cruciferous, so definitely it is going to be helpful to you. But the process of fermentation is also something that you can look into it. When we talk about fermentation, we are having lactic acid bacteria that is formed. Basically, this process helps in synthesizing some of the vitamins, the minerals. They help in synthesizing biologically active compounds in the food, and they also remove the non-nutrient compounds that are present. So whenever we take cabbage, for example, in the fermented form, it is going to give me benefits in terms of helping me lower the blood pressure. It is going to be heart beneficial for me. Plus, it is something, because it's probiotic, prebiotic rich, it is going to definitely help me in my digestion. So using a food in a fermented form is also something that you can look into. Add it into your diet to reduce the inflammation in the body, to reduce the cholesterol, to reduce the blood pressure. Next, I'm going to talk about is the tomato. Tomatoes, even we all know tomatoes are rich in lycopene, which is an antioxidant. So definitely it will help you to reduce your LDL cholesterol. It will help you to improve your blood vessel health. The carotenoids are fat soluble. So you can take tomatoes in the cooked form definitely, because cooking releases the lycopene into the releases the lycopene. You can take raw tomato as well. So you can take raw tomato juice as well. It is a great source of vitamin C, which is again helpful to us. So recommended would be about 1 to 2 tomatoes in a day. That is about 50 to 100 grams per day. Next. This is something that I do want to mention, because this is a very lost food. People have a lot of misconceptions about jackfruit. You know, we label it as being unhealthy. You know, we'll gain weight if we take jackfruit, but this is something that is locally available to us, and it's pretty much vanishing because farmers are growing other foods. Maybe they are growing avocado, maybe they are growing a kiwi. So jackfruit is something that you can look into. It is a source of potassium. It has excellent fiber. It has antioxidants. So it can help to reduce your blood pressure, your cholesterol levels. It has B6 as well. It is a good source of B6. Now B6 we know it helps to reduce the homocysteine levels as well. So definitely it reduces your risk of cardiovascular diseases. The seeds are also an excellent source of soluble and insoluble fiber. So definitely this will help you to reduce your LDL. It will help you to balance your hormones, to balance your sugars as well. Now the recommended dose would be about half a cup or 75 grams of the fruit, or 1 ounce or a handful of the roasted or the boiled seeds. So this is definitely something that you can look into. The only thing that you have to see is that these are foods that should be eaten in a certain amount. If we go overboard, there are chances of having a stomach distress. Next. This is now avocado. It is not actually locally available, at least before, but now even our farmers are growing it. And because most of us do consume it, hence I have mentioned this. So avocado is something that you can include in your diet. It contains 5 grams of muca. It has 1 gram of saturated fats. It has potassium. It's a good source of potassium. It has good fiber in it. Therefore, it can help you to reduce your LDL, your cholesterol, and help you to maintain your blood pressure. But definitely, it is a fat-rich food. And so you can add around 50 grams or so of avocado in a day. Next is your legumes. Again, this is something that many people do not look at as a functional food, as a food that is healthy. Legumes are your beans, your peas, your lentils. They are basically a low-fat plant source which can be included in your diet. They are a good source of fiber. They have very healthy nutrients in them. Legumes are abundant in soluble fiber. They also can help you to reduce your blood sugar levels. They can help you to reduce your cholesterol. They can help you to reduce your LDL levels, avoid the atherosclerotic plaques from forming. So including legumes, basically you include legumes pretty much on a daily basis in your diet, and they are going to give you a lot of benefits. Since we are talking about legumes, another legume which is very popular, which many of us do use as well, is soy. Soy is a legume that is very good for preventing, helping in your cardiovascular health. It can be consumed best in its form as edamame or tempeh. Basically, fermentation is something that is helpful. So you can consume it as your soya paneer as well. It lowers your LDL levels. It is a plant protein that is again a good source of antioxidants. It has good fiber in it. It has estrogen properties in it. So for people, so for women who are perimenopausal, menopausal can definitely benefit by adding soy into their diet. Now, when we talk about the functional foods, definitely there is always a battle between the plant protein over the animal protein. So I would say you go by your lifestyle that you are following, you go by your availability that is there. It is not a moralistic thing over here, but it is something that you need to see as per how your body is in terms of health. So when you choose plant protein over an animal protein, definitely you are getting much more benefits in terms of the amino acids, the fiber, certain minerals, antioxidants in the food, as compared to the animal protein, which comes with a lot of baggage of, excess of calories, cholesterol, saturated fats. So you have to see how you want to balance these into your diet. So if you are a person who is eating a lot of animal protein, then you definitely need to see that you can bring a balance by adding a plant protein into your diet in order to benefit in terms of cardiac health. Next. So when we are talking about animal protein, we do talk about fish. Fish is a lesser complex food that you can, non-vegetarian that you can eat in your diet. Fish is a good source of protein. When we talk about fish, salmon is something that is mostly prescribed. It's a fatty fish. It has a higher protein. It has good amounts of omega-3 fatty acids. It has selenium. It has zinc. It has K vitamin. You can consume at least 3 servings of a fish in a week. It will help you to reduce any kind of plaque deposition in your blood vessels. It helps you to reduce your blood pressure. It can help you to reduce your triglyceride levels. It is anti-inflammatory. So definitely this is something that you can consume a lot more of if you are a person who consumes non-vegetarian foods. Next. Whole grains is something that you have to look into. Our staple is grains, is cereals. So whenever you are consuming cereals, you want to go in for whole grains as best as possible. Try to include at least 6 servings of a whole grain in your diet. Grains are also a source of B vitamins. They are a source of vitamin E. They are a source of magnesium, which are very excellent for our heart health. Next. So when we are talking about grains, definitely this was the year of millets. Millets are something that you must include in your diet as a part of the cereals that you are having. Millets are rich in soluble fiber. They help you to reduce your cholesterol, your LDL levels, triglyceride levels. They are excellent sources of magnesium, potassium. So again, it is very good for managing your blood pressure. They have phenolic compounds as well, antioxidant properties, hence they will help you to decrease the inflammation in your blood vessels. They can help you to balance your blood sugar levels as well because they are low in glycemic index. They have B vitamins again, which will help you to reduce your homocysteine levels. Try to go for millets as per season. Now, one thing which I observe is many of us, we are very extremist. We basically, whenever we look at a certain food, we go at extreme levels to use up that food. So we want to see that there is always a balance in our diet. So there was a time, this was during my college days, there was a time when, soy was like a superfood, everybody was taking soy left, right, and center. They started taking soy milk, they started taking soy nuggets, they started taking soy flour, atta chapatis. They started adding soy flour into their dal. They started having soy as, tofu as paneer. So then what happened is after a period of time, suddenly it became that soy is cancerous. So what I'm trying to say is it is not the bichara soy that has troubled you, but it is because you have used it in excess. So whenever you are using any food, understand that you need to have a balance. Go for seasonal foods. So if it is summer, you want to go in for the jawar. If it is winter, go in for the bajra. So go in for seasonal foods even when you are talking about functional foods. Next. The other food that I want to talk about is oats. Oats is something I love oats. So maybe oats has come from, oats is considered to be like a really superfood. Anybody having sugar issues, anybody having, heart problems will always start having only oats in their diet. Definitely oats have their benefits. So if you do like oats, you can make it a part of your diet. Oats is having a good source of soluble fiber. We know beta glucan, which is present in the oats. It reduces your LDL cholesterol. It is a good source of antioxidants. It will help you to lower your triglyceride levels as well. It can help to balance your sugars as well. So definitely you can make oats as a part of your diet and you can gain benefits from them. Next. So because we are talking about whole grains, it is very important to understand that you just want to make a switch from not so healthy to a little more healthier. So if you are having rice, why not try out semi-brown rice or unpolished rice or the Kerala rice, don't have the polished variety. If you are talking of pasta, you can incorporate at times a whole grain or a millet-based pasta. So it's all about just making this small switch and you can still enjoy your foods and not make it boring or less palatable. The next is the nuts. The nuts are very important in our diet and we of course consider nuts to be like the very good functional foods that we can add for our health. Nuts are excellent sources of antioxidants. They have healthy fats, they have phytosterols, they are good sources of proteins, they have fiber, they have calcium, iron. They are very good to reduce your risk of cardiac diseases. Studies have always shown that when you consume nuts regularly in the right amount, it can reduce the risk of cardiovascular diseases as well as diabetes. Diabetes is, of course, one of the factors for cardiovascular diseases. So when we are talking about nuts, next, we have to understand that the portion control is also very important. So you will find a lot of people, who are working, they say that मुझे जब भी भूख लगती है, I keep on munching on nuts. So they have like a whole bowl full of the bar of nuts in their, at work desk. And throughout the day, they just keep munching on them. So you have to understand that definitely it is healthy fats, it is healthy proteins, but you don't want to overdo it. So what you want to do is you want to see that you are portion controlling it. So approximately about a handful of nuts, it's all I say. Your hand fistful, your hand handful. So whatever your hand handful में जितना आता है, that is your one serving and stick to that. So if you will look at the image over here, one handful of almonds would be somewhere around 8 to 10, 12 almonds depending on the size of the almonds. If you are taking, say, cashew nuts, it would again be around 7 to 8 cashew nuts. If you are taking walnuts, it would be around 4 to 6 walnut halves. So whatever amount is fitting into your handful is your one serving of a nut. So portion control is very important here. Another thing that you can do, next slide. Another thing that you can do to reduce, to portion control the intake of nuts is to go back to cracking nuts. So you can avoid overeating if you sit and actually peel the pistachios or the walnuts. So this is something that you can do to reduce, slow down the excessive eating of the nuts. In case you want to have the shelled nuts and you don't have time to sit and actually sit down and shell the nuts, you can portion control them by, putting the serving size into a Ziploc pouch or else into small dabbis that you can keep. And this way you can benefit from the health benefits and not overdo it. So now let's mention some of the nuts that we can incorporate into your diet. Walnuts have excellent cardiac benefits. We all know walnuts are high in fiber. They are excellent sources of antioxidants. They are the most highest sources of omega-3 fatty acids as well. So including them will definitely benefit you. Include them in the amount that I have defined. Next would be your pecans. This is also something that you can include into your diet. They are easy to digest. They are good sources of zinc, copper. They are good in terms of glycemic index. They are sources of omega-3 acids as well. So again, they are helpful to reduce your cholesterol and your LDL levels. Next is your almonds. Again, almonds are very good to reduce your LDL cholesterol, your total cholesterol levels. They can help you reduce your triglyceride levels. They can maintain your HDL levels. It helps to reduce your systolic blood pressure as well. And many studies have also shown that it helps to reduce your abdominal fat, which is again a very important thing that you need to consider. Your waist to hip ratio is something that we look at. So it helps in reducing your abdominal fat. It is rich in antioxidants, your vitamin E. It is rich in mufa. It is having vitamin K. It is having your B vitamins, B2, B3. It is having excellent dietary fiber. Now the almond skin as well has flavonoids. So you can include the almond skin. So even if you soak them, you can take in the almond skin as well because it does have the flavonoids present in them. Again, the recommended dose would be about an ounce-full, that is about your handful. Although some studies also show consumption of 45 grams per day to benefit in terms of heart health. Next is your pistachios, which are very much popular these days. Even during one of the conferences, we looked at pistachios as being one of the nuts that you can incorporate in for our cardiac health. They are again a source of mufa. They have oleic linoleic acid. They are a source of essential amino acids, and they also have the highest branch chain amino acids in terms of all the nuts. They are having again potassium, magnesium, vitamin K, although they are not sources of vitamin B12. So this is something that can help you reduce your blood pressure. It is having antioxidant properties. It is having it will be helpful for you to reduce your total cholesterol, LDL levels, improve your HDL levels. Dry roasting pistachios can lower its fat content.
You're not audible.
At the time, you will see previously, doctors saying shengdana ban kar do, but peanuts is something that are very, very good in terms of improving your heart health. They are cholesterol free. They contain mufa. They help to reduce your LDL levels. They are excellent sources of protein. They are excellent sources of fiber. They help you to improve your blood pressure as well. They have antioxidants in terms of vitamin E. They also have arginine in them, which helps to protect your endothelial lining. Basically, the arginine, which is the amino acid that helps to produce the nitric acid, which is works as a vasodilator. So again, a handful of peanuts daily can be an excellent way to manage your blood pressure to reduce your cholesterol levels. Next, try and incorporate seeds into your diet. Seeds are an excellent way to incorporate healthy fats, omega-3 fatty acids, fiber, antioxidants. They can help you to reduce the inflammation. They can help you to avoid clogging in your arteries. So seeds like flax seeds, chia seeds, hemp seeds, these are used in diets wherein you can sprinkle them as a mix or just simply sprinkle some flax seeds onto your oatmeal, onto your porridges, add it into your theplas. You can put it on your salad. You can just add it in the curd that you are having as a snack. You can add it just top your fruits with it, or maybe you can have a fruit smoothie which is made with adding the seeds powdered. You can have flax seeds chutney as well. Around 2 spoonfuls a day is more than enough when it comes to taking in seeds. The next seed that I do want to mention is halim. This is a very local superfood, functional food that you can add into your diet. I have seen good benefits of adding garden pressed seeds. They are a very good source of omega-3 fatty acids. They have they are excellent sources of fiber. They have folate in them. They have vitamin C, A, E. They have anti-inflammatory properties. It can help you to reduce your blood pressure. So you can take about 5 grams per day. You can take it around 3 times a week. Just sprinkle a little, halim into your, into your porridges, into your, if you are making a nutrition bar. Basically, they are fat soluble, so best taken with fat sources. You can add it into your porridges. Like I said, you can make a laddu out of it, or maybe an olive oil sprinkled dressed salad. You can put it into that. They do have some goitrogens, so you don't want to go beyond the prescribed amounts. Next. So we can talk about some of the beverages that we can include into our diet to help protect against cardiovascular diseases. So when we are talking about beverages to improve the cardiac health, we definitely want to mention green tea consumption. You can change the slide. Green tea consumption. So although there are not many reports that show benefits from having black tea, but definitely including green tea into the diet can reduce your risk of developing cardiovascular diseases by 10%. If you include coffee into your diet, that can also definitely help to reduce your risk by about 20%. Coffee also has flavonols present in them. So they are very rich sources of antioxidants. You can definitely include them in your diet. Just about 1 to 2 cups of tea. Now, again, I want to mention over here when it comes to beverages like green tea, coffee, etc., you don't want to go beyond a particular amount. Then it becomes harmful for us. You don't want to, literally have bath in your green tea. Just having about 2 to maximum 3 cups of green tea in a day is more than enough to give you heart health benefits. Next slide. Next slide. This is something that I do want to mention. Although red wine is something today everybody is having, alcohol, as it's become like a culture. So, you want to justify your alcohol consumption as well. So since we do have it, I wanted to mention red wine as well, although it's not something that I would actually recommend, but you can benefit from having red wine as well. So some amount of red wine into your diet can benefit you. Basically, it has again resveratrol. It is antioxidant rich. Red wine increases your HDL levels as well. So it's just that you don't want to go again beyond a certain number. So about 1 serving for the woman and 2 servings for men is something that is recommended. So in case you are taking an alcoholic beverage, you can definitely opt for red wine as well. Next. This is something that is again one of my favorites, that is hibiscus tea or roselle sa tea. This is something that I include in diets for people who are having blood pressure issues, who are having diabetes or pre-diabetes, who are having hormonal issues. Hibiscus tea is again an excellent source of antioxidants, carotenoids. It has ascorbic acid. Hibiscus tea helps to reduce the blood pressure. It helps to reduce your cholesterol levels. It helps in insulin resistance as well. It is very good for insulin resistance, and it is also it improves your metabolism a bit, so it does help a little in weight loss as well. Again, the recommended amount would be about 2 cups in a day. Again, one more thing you need to understand when it comes to these teas as well. Like I said, if you are a person who has low blood pressure issues, you want to consider having all these functional foods because they work on reducing your blood pressure. So if you are a person who has low blood pressure, you must be careful when using these functional foods. If you are a person who is on medication for blood pressure, for example, you need to see that your medication is working on you. At the same time, these functional foods are working on your health. So you want to keep a track of your blood pressure. It is very possible that your blood pressure may go down because of using certain foods, and you may have to modify your dose of the medication. So this is something that you must always pay attention to. I'm not going to be talking about garlic because ma'am has already spoken about it. But yes, when we are including, our regular garlic into the white garlic into our diet, you want to crush it just like she's already mentioned it, but I'm just repeating it. you want to crush it. So what you can do is you can crush 1 clove of garlic, put it in water for about 15 to 30 minutes. Let it steep in the water. You can add maybe a lemon juice, you can add maybe ACV, you can add maybe avla juice to it, and you can drink it daily. This is one of the ways in which you can consume garlic. Now, because it has sulfur compounds in it, sometimes it can cause stomach distress. So you don't want to overdo. Again, it is the amount that is recommended. It is the amount that can be beneficial to you. You don't want to overdo it. Next is your turmeric. We very well know turmeric has excellent cardioprotective properties. It is having anti-inflammatory properties. It is a rich source of antioxidants. The curcuminoids, the major bioactive curcuminoid is your curcumin. It helps to improve the functioning of the blood vessels, the lining of the blood vessels. Now, when we talk about turmeric, the best way to take turmeric, next slide. The best way to take turmeric would be with pepperine. The reason being is that, first of all, turmeric is having a very small amount of curcumin by weight of turmeric. So when you are consuming it, it is not very easily absorbed into your bloodstream. So pepperine from black pepper is seen to enhance the absorption of curcumin. Hence, curcumin taken along with pepperine. So taking haldi along with pepper would be something which will give me maximum benefit. Curcumin is again fat soluble, so taking it with a main meal, after a main meal, or with a fat included meal is something that you can look at. Turmeric, if you are taking fresh turmeric, then you can go in for about 1 teaspoon with around 1/4 teaspoon of pepper. This is something that you can include in your diet to give you health benefits. Next slide.
5 सुबह 5 बजे से डाइट में लोग सोचते हैं पगला गई सुबह 5 बजे डाइट भेज रही है लेकिन मैं भेज दूंगी सबको ये 6:30 की मेरी फ्लाइट है.
The next functional food that I am going to talk about is ginger. Ginger is again a very antioxidant rich food that can be included into your diet. It has polyphenolic compounds. We know ginger as gingerol. It has antioxidant properties. It is anti-inflammatory. It can help to avoid the plaque formation in your arteries. Taking around 3 to 5 grams of ginger per day can help you with your cardiac health. It can help you lower your LDL. It can help you lower your blood pressure. It is also seen to significantly drop your CKMB levels. Of course, you need to again understand that just like garlic, ginger is also something that increases the, it can slow down blood clotting. Basically, whenever you are using ginger, garlic, turmeric, these are something that you have to be careful with when especially your patient or the client is on blood thinners. You have to be careful when using these because they can increase the risk of bleeding. Next is your cod liver oil, age old, from childhood, bachpan se we've always had, cod liver oil capsules. I'm sure at least people from my generation remember having every day 1 capsule of cod liver oil. So this is also something that can be looked into. It is a source of fatty acids, the omega-3. It is having vitamin A, vitamin D, K, your iodine. It has B vitamins. It helps you to improve your HDL levels. It helps you to reduce your triglyceride levels. It can help you to maintain your blood pressure as well. Next. This is again something that I want to mention, that is your dark chocolate. Because we love our chocolates, so again we want to justify our intake of something sweet. So I have mentioned dark chocolate as well. So dark chocolate basically having a cocoa content of about 70 to 80% is something that will be beneficial. It has flavonoids. It helps you to lower your blood pressure. It contains stearic acid, so it helps you to lower your cholesterol levels. It also contains flavonols, theobromine, which is again very good for your cardiac health. But remember, moderation is the key. So the recommended amount would be about 45 grams per day. Next. So when we are talking about functional foods, you have to understand that it is not about a single food. It is not just about one individual food, but it is about the whole diet. So whenever we are talking about functional foods, it is something that you add to your balanced diet. Next. Public people usually love magical foods. So what happens is when we talk about functional foods, they think that just adding, one food item is going to help them. So just adding a walnut probably into your diet or just adding one garlic into your diet is not going to help you. It is about a balance of your diet. It is about your lifestyle as well. You want to be active, you want to exercise, you want to reduce stress in your daily life. You want to manage your weight. You want to see that your fat percentage is low. These are all important things. Only and only if you work with all these things, your functional food is going to benefit you. So it has to be coupled with a healthy full diet and right lifestyle if you want to reap the benefits. Last slide. So despite the fact that we are having our pharmaceutical industry, the so-called health industry, which is having drugs that are supposed to be beneficial for our heart health. So majorly today you will find a little bit of a rise in your cholesterol levels, total cholesterol, and the doctor suggests statins. Despite that, there is still no reduction in the cardiovascular diseases that are coming up. So I encourage all of you dietitians, all healthcare professionals to actually teach about diet and about lifestyle modifications to your clients, to your patients, if you want to avoid the risk of developing any cardiovascular disorder. Our body is, a mechanism which has the power to heal itself. So if you want to improve your health, you need to support your body. So heart attack and stroke is the #1 leading cause of death worldwide. Today we are seeing a lot of cases coming up, but we need to understand that it is something that is preventable. You just need to trust Mother Nature. You need to trust your body. Thank you.
Thank you, Jennifer. It was indeed a very practical tips that you gave about diet and nutrition. It will definitely help a lot of people listening to you, because sometimes we do, overlook certain foods which are present in our kitchen, and we may have, not thought about it when we are speaking to our patients. So coming back to my talk and to Jennifer's talk, can we have questions if anybody has? If you want to unmute, you can. If you want to write it in the chat box, that's also fine. Why Nalini could not join the first lecture? Very sad, Nalini. You missed my nice cardiac markers, which I spoke about. Maybe you can join, maybe Nalini, you can look at the website of the Academy of Nutritional Sciences. We will be very soon uploading the we will be uploading the talk which I gave on cardiac markers. Ekta, you will also be able to read the notes on, you'll be able to hear the lecture on cardiac markers. Yeah. So what would be the quantity? So as I said, you can use black garlic just as normal garlic, though. See, anybody cannot eat too much. So you can eat 1 or 2 cloves per day. Now, first of all, it is very difficult to get it because you're not going to go all the way to Korea. There are some platforms which sell black garlic. Nevertheless, I would say that black garlic extracts in forms of supplement are available. Y'all can look out for those supplements. Our sponsors are also having black garlic with them. Maybe you can get in touch with them. No, you can't prepare black garlic at home. It needs 60 days to 90 days of fermentation in a controlled environment. So it is not the same as burnt garlic. So do not get confused. It has got S-allyl cysteine. Most of y'all have got a reward also for it. S-allyl cysteine is the bioactive compound that is present in the black garlic, and because of which it is a stable compound, which is a little different from the allicin, which I explained. Yeah, how long does omega-3 capsules or cod liver oil capsule should be taken? This is for Jennifer, if you can answer this question. How long should it be taken?
Most of the supplements, I always say you can take it for 3 months, then give a gap, and you can always take it again. So you can go in for easily for taking supplement for 3 months. There
Okay.
is no harm in it.
Yeah, thanks, Jennifer. In fact, if you are eating fish, enough of fish, then you may not need a supplement. Or if you're a vegetarian and you're not having enough of omega-3, then you can take omega-3 capsules. Even vegetarian sources are available. Yeah,
Should we do
yeah. Yes,
should
somebody.
garlic or ginger empty stomach, or can we suggest them take it in a mid morning or as a mid evening
Correct.
or at
So,
bedtime?
see when we are giving garlic or ginger, why are we giving it? We are giving it because we want the patient to benefit maximum. Okay. Definitely, when a person is taking something on an empty stomach, there is a high level of absorption that happens, and therefore we want to give it on an empty stomach. Now, you have to understand your patient very well, because if you are giving something on an empty stomach, if the person already has a gastritis or has some problem because of which they cannot take it, then you can mix it with other foods and give it. So you have to understand how to give it to your patient. Therefore, you have to understand your patient and give accordingly. Then there's another question on from where can we get. So as I said, you can get it from gourmet stores. Black garlic is sold there, but if you cannot get it from the gourmet store and you want to give it to your patient, you can use a supplement. Then does the garlic ginger for patients on warfarin? Yes. Don't give patients on warfarin or acetylene too much of garlic, because that is an anticoagulant. It can cause thinning of the blood. So generally, we avoid giving patients warfarin, these kind of anticoagulants.
Ma'am, blood thinner and leafy vegetable, is there?
No. So leafy vegetable is vitamin K. That is this phyloquinols, that is very different from this. So although you have to restrict those also in warfarin, but that maybe I'll give another talk for that.
Ma'am, one more question I had. Vascular calcification was some case I came across, and doctor had tell them to restrict calcium, but then
Yeah.
how could we?
Correct. So if you look at I hope you were there in my lecture where I spoke about the calcium score. So now in the calcium score, when you do a calcium score, some patients, of course, doctors do restrict calcium because their calcium scores may be high. But if you have not done a calcium score of the patient, it is either you're saving your heart or your bones. So, the best way to give calcium is to give calcium in the most bioavailable form, so that the bones are not affected. At the same time, there is no deposition of the calcium along with cholesterol to form plaques in your arteries. Therefore, there has to be a very thin balance between how much to give and how long to give, especially if you're giving calcium supplements in form of calcium carbonates. See that you do not exceed the recommended allowances. Go through the NIN new recommended dietary allowances for calcium. Give calcium based on the recommended allowances. If the patient is taking adequate calcium from the food, then you do not need to give additional calcium supplements. However, if the patient is not taking adequate calcium from the food, you can give a small dose of calcium supplements. Preferably, calcium citrate is a better source to give as a supplement. However, you can decide as to what is required based on the RDA. Okay. Can black garlic be added to the meals? Yes, it can be. Yes, it can be added. Is there any trusted brand of black garlic? Yes, I do use the True Healthy black garlic when I have to give it to any patient. But you can use a good brand, whichever you are comfortable with. That is very important. And any question that I have missed? full forms of, okay. Oh, yeah, Mithani, I'm sure I will put in a word. You did write the full form of the SAC. Maybe I will ask the
SL16. It is SLL16.
SLI16. Yeah. Who's talking? Rashmi. Okay.
Yeah, ma'am.
So yeah. So Rashmi and Hajra, both of y'all have written the right ones. Maybe I'll put in a word that y'all also get a reward for that. We will send you the samples of the black garlic supplement. Okay. Any other question about the test, the troponin test or the cardiac marker test? Anybody has any questions with regards to that? No? Was my lecture understood or not understood at all?
I just had a query. Do you yourself as a dietitian ask for these tests ever?
No, no.
Or
No. So I don't ask for any test of cardiac markers because usually the patients who come to us are from the cardiac rehabilitation center. And when they come to us, they have already done these tests and they have come. So the patients who come to us have already met a cardiologist and they have come to us. So mostly they already have the test done. Secondly is that it's not like the sugar test where you find somebody going into a hypoglycemia and you ask for test and all those things, because if you are even suspecting a patient to have a cardiac arrest, I think the first thing you should do is a med call or get your doctor to check that out.
thank you.
Yeah, link for the supplement. Okay, link for the supplement. I'll ask Monica, I'll ask the company to get in touch with you, or you can drop in a message for me. Maybe I will share with you on personal chat. Okay, so all of you, if you all want to listen to more lectures like this, and if you all want to be a part of the academy, please do join in the WhatsApp link. I hope one of the girls put in the WhatsApp link. Join in because we do have a lot of sessions. Our session in June, which is going to come up, is on critical care nutrition. So we had a lecture on total parenteral nutrition, which was very I would say well taken, but there are many who had missed the lecture, so they have asked for a re-lecture. We will be giving them a re-lecture. Plus, we will be having a hands-on class on enteral nutrition. So if you want to learn how to plan an enteral nutrition, right from the basic, right from the calculation of the energy, protein, etc., be alert of the information that is coming. Yes, Ekta, we will definitely put the lectures in the group so y'all can join in. There are number of lectures that we will be uploading on our website as well. So I will share the link of the website. Y'all can go back and listen to those lectures. Any questions related to this topic? If you want to still ask, Jennifer and me are there for the next 1 minute. So we can take any lectures, any questions. Yeah. Thank you so much, all of you. You all were a very good audience. You all waited for almost 2 hours here. And really glad to see so many of you. In fact, it is an overwhelming response. We had almost 200 people, joined in who had logged in and they listened to us, which is a very good thing. And I'm hoping to find you again. Thank you, Zankana, for understanding the lecture, because I'm glad that you all have taken something home. Some of you have taken something new today. So keep in touch with us and follow us. We have our Instagram and the other social media handles as well, where we keep putting information. So do join in the enteral nutrition or the critical care nutrition lectures that are going to happen. Plus, we are going to have a lecture on pediatric nephrology, pediatric renal cases specifically for kids. So join in that. We'll announce the dates very soon. Okay, so signing off for now. Jennifer, do you want to say a last word?
Thanks, ma'am. It was a great honor to speak along with you.
No, my pleasure, Jennifer.
I hope it was
Yes, it
beneficial.
was
Thank you
excellent.
so much for having me.
Yes, all the girls, they are replying that they have enjoyed the entire lecture. Thank you, Jennifer. And thank you, all of you.
Thanks, ma'am.
Bye.
Thank
Good night.
you. Bye.
Thank you, ma'am. Thank
Bye,
you, ma'am.
The Deepa Singh done.
Thank you, ma'am.
Deepa Das King done. Hmm.